Hello, welcome back to the Resilient Aging Unfiltered podcast. We have here my first mentor in this world of Alzheimer's disease, such an important, influential person in my life, Jan Dougherty. Thanks for being here today, Jan.
Well, thanks for inviting me.
I'm going to tell everyone a little bit about Jan and then we'll dive in. Jan Dougherty is a nursing expert and leader in Alzheimer's and dementia care, crafting award-winning innovative programs to support people living with dementia and their family caregivers across the care continuum. For over 3 decades, she's pioneered unique programs being used in Arizona and nationally and internationally, received numerous professional and program awards and recognitions in addition to that. Jan is a noted speaker, author, and educational designer of professional and family caregiver education programs. And then she is on the forefront of the dementia-friendly community movement, making Tempe, Arizona the first dementia-friendly community in Arizona. And then her book entitled Travel Well with Dementia, Essential Tips to Enjoy the Journey offers the first comprehensive look at supporting travel for people with dementia and their families. She also works with Phoenix Sky Harbor Airport on their dementia-friendly airport initiatives, really pioneering the way for that. And that's a lot of what we're going to talk about today is this world of travel. So Jan, maybe we could segue right away into what led you and when did you bring in this whole concept of travel into your work?
So I guess it kind of came in like a lamb, if you will, and then turned into a lion over time. So I had the opportunity of working with Banner Alzheimer's Institute and innovating with the family and community services programs. And that allowed us to meet with people with a new and ongoing diagnosis of whatever form of dementia, as well as their often primary and family care partners, caregivers. And when we would sit down and talk with them about what's important in the next coming 6 months, travel became a theme. Following a new diagnosis, particularly if there was mild cognitive impairment or early AD, we had the person who was diagnosing, I always dreamed about going to XYZ. And like many Americans, adults tend to forestall travel until their retirement years, and then boom, something happens to now prompt them to say it's time to do something. And for the person who is progressing in their condition, it's often the family then who says, we have a reunion, our granddaughter's getting married, the grandson's graduating, whatever. There's a funeral we have to attend, and that's going to prompt travel. So along with that, and being aware that when we were able to counsel people towards tips to create more successful travel, it was really helpful. And when we didn't know about travel and they came back to visit us, they told us how horrible it was and they're never going to be traveling again. And that was a concern. And at the same time, I had a nursing colleague of mine who was beginning a travel companion business, which was largely relocating an older adult from wherever they lived into a residential setting, usually someplace closer to home. So I was working with her on that, and I had this aha moment, we had this nice little guide that we provided, and certainly the Alzheimer's Association has some little tips, but it was far from comprehensive. And I thought at that moment, I really want to write a book that provides very practical tips so that if you're not seeing a dementia specialist, if you don't have access to a social worker, a nurse who has this pragmatic information, because our physicians don't have time in their clinical setting to really counsel and assess for that, nor do you think about travel typically as at the top of your list of things you're trying to problem solve. And so that really is what got me thinking about travel and made me sit my rear end in a chair and write this book about traveling well with dementia.
Wow. Thank you for doing that. I know it's not an easy thing to write and publish a book, that's for sure. I know personally that's something that's always struck me when patients and families stop traveling, and it's very important to me personally to keep that going. And I often would think it seems like they should be able to still travel, and I don't really have the time, like you're saying, to try to dig into and be a detective and uncover why and then try to help. And so it's so valuable. And I know that travel is a passion of yours too. So I'm sure that probably informed your interest in this area.
Yeah, especially looking ahead. I'm part of that baby boomer group. And we know that boomers love to travel, and we know they're going to want to continue to travel even with a diagnosis. And
Hmm.
so that was also another impetus, I think, for me to write something thinking about how could I help this next generation of adults who are at risk for and will develop Alzheimer's disease to be able to stay connected to the people and the places they love for as long as possible. So for me, that's really what it's about, is that connectedness. And what we know about travel is 80% of travel is about seeing family and friends. And it just doesn't change regardless of your age or whether you're living with a progressive condition like Alzheimer's disease, right? You still have a desire for that connectedness. And families will say, well, what does it matter? They're going to forget anyways. Well, it matters in the moment. It matters for those who are around them
Yeah.
to still have this opportunity to create their own memories and to show love and respect and have fun with a person, even if it fades relatively quick. That shouldn't take away from the experience. And I often parallel it to attending a concert, something that I don't do regularly, but when I do, I think, man, that was awesome. Why don't I do this more
Mm,
often? And then it fades relatively quickly, but
yeah.
did it take away from that moment? Did it take away from that experience? Of course it didn't. So why should travel and connectedness for people with memory loss who are going to forget that it happened, why should that be less important, right? That to me is a really big thing that I often challenge people on and push back and say, wait a minute, really, if they're not displaying symptoms that can't be managed during travel, let's talk about that. Because I think you're shortchanging an opportunity, not only for your loved one, but as important, these other family members to have these moments of creating memories for themselves with this person.
I love that. Yeah, thank you. I love that analogy to a concert. That's great. I'm totally going to use that. Now, you've published, you've been the first to publish this comprehensive guide for people and families living with things like Alzheimer's disease and wanting to travel. And I've heard you speak multiple times, giving all sorts of education and tips. Now, with aging in general, there can be any number of challenges or disabilities that arise and or plus, things like Alzheimer's disease. And I wonder if when you're counseling people, you kind of think about it all the same in the same bucket and then then I'm curious, do you think about the Alzheimer's piece as entirely separate or it's just one other disability that needs to be planned ahead for?
I think it's just another disability to consider, and again with nuances. So if I'm counseling an older adult who has mobility issues, for example, I'm going to really hone in on mobility and let's look at that and what kind of adaptive
Mhm.
devices might be helpful for you, or let's look at your footwear, or should you see a physical therapist for a little tune-up, right, to strengthen before you're going to take this trip that's going to require more walking, or might there be stairs to negotiate, is there accessibility? And for the person living with a dementia, obviously, I'm much more concerned about their level of confusion and how do you as a family manage that confusion? And does your family know that there have been these marked changes since you've last seen them? And when you confront this person who is living with this condition, do they tend to get really upset? Are there symptoms that you're finding very challenging to manage at home? Because then we're going to need to think about same thing. What kind of adaptive strategies are we going to need to manage on the road? So now I'm not adapting your gait. I'm adapting kind of your approach, right? So it's similar but different. And I think there is more awareness around ambulatory issues than there are around a lot of these hidden disabilities. So, certainly dementia is a hidden disability. I love that it's being talked about globally as a hidden disability because after all, the person looks normal and they sound normal until something unusual presents. Well, I think about people with profound hearing loss. We can quickly assume, well, they have a dementia when in fact they just couldn't hear and process because we didn't accommodate their unique needs. And so there are a lot of these disabilities that the more we know about, the more we can provide counsel and really think, well, what are the ways we can help you to accommodate, or how do we fit what you want to accomplish in travel so that it will be successful?
Great. Do you have a set, like a standard battery of questions? Like you started to ask some things that you would ask a family that approached you about this, or does it just depend on like very case by case?
Yeah, I mean, there certainly are, and certainly in my book, I've outlined kind of 10 things to be aware of that says maybe you need to reconsider travel,
Mm.
from, kind of the level of confusion that you're seeing to the behavioral presentation. So if the person is sundowning every evening, right, we're seeing that increased confusion and agitation, and you're not able to manage it well, versus it's relatively short lived and I have these strategies to work around it. Or if these folks have, fixed false beliefs that we like to call delusions, which are very common for many of these folks, right, due to their ongoing confusion, how is it that we temper that, or will that become too distressing during the travel? So one is assessing, what are the things that you find challenging for your person that we should think about and problem solve. And then you as a caregiver, guess what? You're the appointed travel companion. Let's talk
Mm.
about you. How do you manage it? How stressed do you become during travel? Are you
Mm.
prone to getting upset? Are you prone to getting anxious? Are you more likely to yell at your loved one? And this is where I say, because they're going to mirror exactly what they see in you. So if you're not prepared, then we need to start working on preparing you. And then there's the family. And again, I'm going to talk a lot about family because 80% of the travel. So there are the folks in earlier stages who want to do a bucket trip list. And I am all for that. And boy, I would bend over backwards to help people plan and execute that. But for people who are progressing in their disease, more in the moderate stage of the illness, now this is where I'm going to say, let's spend some time and let's be real about the family. And what are their expectations? What do they really understand about your loved one? And if you have been hiding from them these changes because, you respect your loved one, you don't want to show them in a poor light, well, guess what? They're going to show up, and then they're going to demand that this person be who they were during the last visit, and they've changed, and now they're growing tensions. This is where a lot of the fights ensue, or the family starts correcting the person living with dementia, and things bubble up, and then this is where things go south and travel ends, and families become fractured. And that just, it really does sadden me, because I think, we could have problem solved that. We could have had an open and honest discussion. And again, if the family can't accept it, then maybe this is not a visit you want to do with them. Or maybe you say to them, maybe it's best I leave my spouse, my parent, whoever that is, at home, and I'll make the visit because it's going to be too demanding. So kind of those three things I assess.
That's great. That's so helpful. And it sounds like a requirement, especially for people who are in the moderate stages or later, is that the families are willing to be open and honest and direct and straightforward and realistic. So,
Yeah, I
think
think the other is setting reasonable expectations around travel, and particularly when I talk to groups of older adults. I say you're not 25 anymore. And if you haven't traveled in 10 years, you're not 65 anymore, you're not 75 anymore. Add on those years and think about realistically what has changed in you. And again, I'm not trying to discourage travel, but I'm saying let's prepare for the kinds of supportive things that could help you travel successfully. There's no shame in asking for a wheelchair transfer. There's no shame in asking for an accessible hotel room. There's no shame in saying, I can't stay with you anymore because I can no longer navigate the stairs in your home, or we can't tolerate the noise that the children bring. And they shouldn't have to be silenced, right, in their own home. They should be able to live their lives. And so those become really important discussions to say, let's set up the expectations, and let's just plan that you're going to have some rough days. One of my former colleagues used to say, let's plan travel around the person's worst day possible. right? So then you can think about, well, what am I going to do on that bad day? So this becomes a realistic way to think, well, how do I, one, prepare my family or other travel companions that we might have some rough days and we're going to stay in? So that means we're going to choose maybe a full service hotel when we travel, or I'm going to book a group travel where I know I can stay behind in the hotel and I don't have to get on a bus, right? Those kinds of things. Or I've got trip insurance and I know if I need to cut the trip short, I can do that. And so I think, we want to think about, especially as we age, things happen. They just invariably do. And so how are we going to manage that? What's it going to look like for each one of us?
Having backup plans.
Yeah, backup plans, B, C, and D.
For people who are at the earlier stages of these diseases, like Alzheimer's disease, who maybe have like mild cognitive impairment, what kinds of trips and durations of trips do you see work best?
Yeah, and there's going to be no one size fits all. A lot depends on what kind of travel history do they bring. Are they a relatively savvy sort of traveler? And now we need to build in some additional kinds of reminders for them, right? Because the biggest issue, as I talk to people with MCI and early Alzheimer's disease, right, is managing time and time concepts. So I see a lot of them missing flights or missing a booked tour or missing meds, right, because they're not managing those time relationships. And so I think finding strategies around that becomes really important. And then it's really like, well, what for you is comfortable travel? Because often for people, cruising becomes an easier way of travel because, right, you're assigned to a room, you go to the room, you've got meals accessible. If you don't want to get off at a port, you don't get off at a port. This is where I'd say don't go out on the group trips. Book a private tour, book it at a time of day that is best for you, because often, these ships will arrive early in the morning. You don't want to be first off the ship. For most people, right? We know that their days will start a bit slower. So book it closer to 10. And then let's be realistic. How long can you really be out? And about, 90 minutes to 2 hours for most people works pretty well. And then maybe you need a break time and then another hour and then it's time to come back. So it's really building in those concepts of what is going to be needed in order to be successful.
When you're saying all of this, I can imagine families, especially saying themselves, wow, this is not how we ever have traveled in the past. All of these additional different preparations, all of these needing to modify and shorten the duration of things that we would have done. It's not like, as a care partner, maybe my preferred way to travel anymore. Maybe let's just not go. It's too much. I don't want to deal with all this. Like, do you hear that? And how do you respond to
Oh,
that?
yeah. In fact, I gave a lecture just this past week at an older adult community, and I had a woman at the end come up to me and said, based on your talk, I'm not going to travel anymore. And I said, well, I'm sorry to hear that. I think that's unfortunate. I know you're living in a beautiful setting, and, if you're comfortable, that's okay. It's certainly okay not to do that. So this is where I really encourage staycations or just a shorter trip. So maybe doing a week-long trip seems kind of overwhelming, but have you thought about taking a 1 hour flight, and here we are in Phoenix, over to San Diego and getting a hotel and see if you want to rent a car or whether you just want to take taxis or Ubers and see how that goes. Get a full service hotel, and when you come back, you talk to your mate about how do you think it went. You evaluate how comfortable did you feel? Did that give you a better sense and give you greater confidence? So I think that can be helpful too. Or just staying here in town. Let's see what it feels like to leave our house, right? Because these, especially with a dementia, that people tend to become much more homebound, right? It's just a whole lot of work, especially in the moderate stages, to get somebody out and wrangle them, if you will, sometimes in terms of being at the store. So let's see what it feels like to check into a local resort where, again, everything's here for us. And maybe we go out for a movie, we just go out to lunch. We keep it relatively simple and we see how it goes. And the worst thing is it doesn't work. And you come home and you think about, okay, how could I have done something differently? Or you come home and go, that worked pretty well. And I
Yeah.
think I can now manage that. So I think sometimes a shorter abbreviated trip can give, especially the care partner, caregiver, the confidence about what it is they need to do and break it down. And then, communicating to people again about here's how it's going to play out. So in the past, the last time we visited you guys 2 years ago, yeah, we could go to all the soccer games and we went to the concerts and we could go to dinner later in the evening. But you know what? 2 years, things have changed. He can't handle this much activity. He really needs some down period. So let's talk about what each day is going to look like and what's most important that you would like us to do with you and the kids, right? And
Mhm.
so as we have those open and honest conversations, then guess what? It generally works. And or maybe the caregiver says, I'd actually like to do more. Could one of the kids stay back, or could you stay back with dad or mom and keep them company? They'd love it. Maybe you could make some cookies or whatever. Tell them kind of what it is that they enjoy and what you might direct. And then you, as the caregiver, go enjoy the family and go see the soccer games and the concerts and all that. So, again, it's just rethinking and communicating this is what I need from you to be successful in my visit to you. So that's a big part of it, because when we're younger, we don't have to communicate those things in advance
Mhm.
typically, right? We just go on the fly and we problem solve, but now this is a little more challenging.
I I'm thinking about how some of what you do that's so powerful is giving people scripting and words and language and to have how to ask these questions to their family members. That they had a way to communicate with forever with their adult children, and now things have changed and you have to engage differently, and it's really hard, but to have that and the way you modeled it just right there, it's so empowering and you make it seem really accessible. So that's so helpful. And I like that there's this possibility that, well, the staycation idea is brilliant, and we live in Arizona, so
Yeah.
we're
Yeah.
lucky that that's
Yeah.
so easy
Yeah.
for us here. But I could imagine it could turn out to be so surpass the expectations of the care partner, and you discover things in your area that you maybe never would have, and maybe have special new experiences with your loved one. So that's really brilliant. Thank you for that. Now, it seems like to me like you have so many tips and tools and tricks and hacks that you provide, and it's mind-blowing and so helpful. Maybe we could go through some things. So you in your book, you share planning tools and packing lists. Can you tell us a few or some overlooked items that can really change the experience?
Well, one common theme I often run into with families who haven't traveled in a while is that the care partner, caregiver thinks their loved one can pack and they don't double check. And then, not to be sexist here, but I think often the women are packing for the men over the years, right? And about this cohort group now, anyways, of older adults. And so now, if it's the woman that's affected, it never occurs to the husband, oh, I should have checked to see how my wife packed. And now we're out on this Alaskan cruise and she's packed like it's the middle of summer, because in fact they're going in the middle of summer and there are no warm clothes, right? We're now on a ship and not having appropriate clothing because I didn't even think to double check about what it is that they were putting in, or something that they completely negated to pack altogether, which could be socks, it could be underwear, it could be the jacket that was much needed. I often find that it's during trip preparation that one of the things that is identified is the lack of a current identification card. And right, we had all the brouhaha about the real ID. And in fact, I've talked to people who said, well, we can't travel anymore because I can't take them into, the driver's motor vehicle division and get them a new license. They'd want a license, not an ID, yada, yada. And this is where I share you can still travel but have multiple forms of ID. So it could be their Medicare card, their prescriptions, a
Mm,
credit card that has their name, an expired driver's license is fine. And just know you're going to spend a little more time with TSA, but it doesn't mean that travel has to stop. And that to me is really important to try to communicate to older adults because they're very gun shy about renewing some sort of identification card, right? So that becomes something. Medications, typically people will be on top of that because older adults are pretty familiar with that. But do they carry a list of medical providers in case something would happen, or a list of medications? Often not. They don't think about it. And
mm,
let's face it, when we're pressed, and if suddenly, I take a spill, which happens a lot in travel, people will take a fall or they're develop a urinary tract infection because they're not drinking enough fluid. And now I end up in urgent care or an emergency department. I might not remember what all those meds are that my loved one is even taking. So things like that. So the tools I put together really kind of help people prepare about these are all the things you need to bring along or things you need to be thinking about. And this is why we're going to have you double check packing because, we have somebody that actually packing is a pretty complex activity.
mm.
I certainly know, and certainly, I volunteer at Sky Harbor Airport as a navigator, and I've learned to pack pretty wisely. So if I don't need to check a bag, I never check a bag. But I see people hauling all these huge, huge bags, and I'm thinking, you don't know how to pack because if you did, you would never be hauling this many bags with you, right? Because it gets
Right.
in the way. But it's complicated to figure those kinds of things out. Where are we going? What kind of dress do I need? What the weather's going to be like, right? It is pretty complicated executive tasks that we have to think about.
Yeah. Wow. I'm curious. I was thinking, that's also helpful for sharing. So it seemed so common sense, those things you just shared, but like, why would you if you've never brought those things? Like a list, you just share a list of your current medications and medical or whatever. But so valuable if a situation arises. Um, I was thinking about how I've personally tried to not check a bag as much as possible because of all of the flight delays and things that happen now. And I wonder if there's anything related to the changing how air travel has evolved in the past few years or devolved that informs your advice for families.
Yeah, so this is tricky. My preference is that they would check their bag, so it's one last thing that have to
I
bird
see.
dog, right? So this is a point in time where I say, yeah, pack light because you don't want to be hauling a huge suitcase, but you also don't want to be hauling a suitcase when it is you're trying to keep your eye on someone who maybe moves faster than you do, right? You don't want to lose sight of them. One of the things that commonly happens in the airport is that going through security, which is really by far the most stressful thing that happens for almost every passenger, is the amount of stuff that's left behind. Again, people leave their phones, they leave their keys. I've seen people leave their luggage. I saw one week where the husband left his wife and he's saying, I can't see my wife. Where is she?
Boy.
And I'm thinking, you didn't think to wait? Again, you think you can't make this stuff up,
Yeah.
but the distractibility of people and the anxiety and their people are in such a hurry when they travel, which is why we say, we counsel people get to the airport in plenty of time so that you don't have to be so stressed when you're going through the security line that you take your time to gather all your valuables. So, we do a lot of counsel with our folks around TSA and how they should never be separated from their loved one. TSA has a wonderful program called TSA Cares. So people can put that into their browser and go to the government site. And they have what they call passenger support specialists who can companion you and your loved one through the security process. And by the way, you don't have to provide a medical history. They're not asking for medications. They're just saying, kind of what's going on, what kind of help do you need? So you don't even have to use the A or the D word, right, with a specialist, although I often encourage that the more you tell them, the more helpful they'll be. That I'm bringing my mother through. She has dementia. She thinks very slowly. slowly. I need you to just ask her one question at a time. Please show her before you touch her. That sort of thing can be very, very helpful. It's a free of charge, and all that's required is that you notify TSA 72 hours in advance of that upcoming trip. If you forget, which many people do, right? Because there's, as a caregiver, there's so much you've got to pull together before a trip. When you present at the TSA line and you get to the front of the line, you just say, I need to have a supervisor, and they'll call for a supervisor. And by the way, they have these folks who are trained as both male and female. So it could be one week I was companioning a woman who clearly had some serious mental health issues, and I was very concerned about her going through TSA alone. So I companioned her as a navigator volunteer. And when I got up to the front, I said, I need a female supervisor to take this lady through security, right? Because I was very concerned, should she need to be touched in any ways, if anything would show up, that would exacerbate her mental health issues that were quite apparent anyways. And my goal was to get her on a plane and get her back to see her daughter. So this is where the TSA support specialists, we provide added training to them, can be so incredibly helpful and really slow the experience down and allow then the family to make sure they've got everything they need. In some places, the support specialist will even companion you to the gate. And by the way, you don't have to be in a wheelchair to have a support specialist. You can be ambulatory. So I think that's really helpful when you're companioning a person who walks much quicker than you do, because let's face it, the internal focus that comes with a progressing dementia means that I'm not thinking about you, and I just take off. And there you are trying to get everything together, and they're ignoring you, and boom, they're off to who knows where, because they don't know where. So that can be helpful.
Thank you. Is TSA Cares, is that available in every airport in the
It
US?
is. It is. It's a requirement by the federal government. Now, one of the things, it just depends what their staffing is for the day, and will they have somebody there to meet you at a checkpoint? Can vary, especially in some of the larger airports, but it's absolutely something worth asking for.
And can you just repeat, so when do you ask for supervisor, in what,
So
like,
if you did not complete an online application for a passenger support specialist, they also have a 1-800 number that you can call. And give the information. So when you present to the officer, present your ID and your ticket, you can say, I would like to have a TSA supervisor to companion my loved one and myself through the security process. One of the things many caregivers will have is these little we call them companion cards that says, I'm living with somebody with Alzheimer's disease. I crafted something similar. My travel companion has problems with memory and thinking. Your patience is appreciated. And then on the back of it, I give tips for how you can communicate. Look at me directly, ask me, call me by name, ask one question at a time, please give me time to respond, smile, those kinds of things that can help make communication better. So sometimes a companion card can be just really helpful to provide to the officer, particularly for the person who doesn't have insight and they don't think they have a problem, and the A word and the D word are very uncomfortable to hear. Then this to me is a very dignified way of just letting them know we need a little extra time here. And you could just simply say, we need some extra time here. They get very anxious going through security, and we must stay together.
brilliant. Wow. I hope more people take advantage of that, offering this patient passenger support.
Yeah, we're trying to get the word out.
And we'll include information in the show notes about that
Mhm.
program and how to access it. In terms of getting the two people to stay together, say, do you recommend any kind of tracking products, or like AirTag, things like that, to have the person hold?
Yeah, I certainly do. And the GPS technology has come so far, thankfully. So, yeah, I find that many families are using AirTags and slipping it in their loved one's pocket, or in, because ladies still, by and large, will carry a purse as they're out and about in the community or as they travel. There's some wonderful sole inserts that can be put in shoes, and I really recommend that in the home setting for the person who still likes to go out and take a walk every day. Again, that GPS technology is really quite nice. There's a new credit card size a card. Literally, it looks like a credit card, but it's not. It's called Chipolo that can fit into a wallet or a handbag once again and provides the technology. And then certainly, I think people also rely on phones. And I think the phone is a really wonderful tool. But here are the two caveats that I have for people with memory loss who have phones is that one, it be turned on, and two, it be actually fully charged. So Find My Friends is not going to help you if they don't have their phone on. And, with many older adults, I find this as well that they don't keep their phone on because they're not anticipating they're going to need it. Well, that's not helpful when that person is out running errands and you're looking for them, and now there's no signal to that. So, another thing that many care partners have shared with me during travel is that they will take a picture of their loved one every single day, so that if they become separated and the GPS technology is not working, or the same thing, you're calling law enforcement or security, let's say wherever that is, you could be on a ship, you could be in a casino. I mean, I just see people getting separated all the time. You can provide a description of this person, or they can distribute their picture so that now they know specifically what they're looking for. I say,
Wow.
I give this example, but I mean, I kissed my husband goodbye this morning as he went off from work, but I couldn't tell you what in the world he was wearing.
Yeah.
No, I don't pay attention, right?
Well, and also that, yeah, that's so brilliant, and that could be fed into law enforcement monitoring, video monitoring, surveillance systems if someone they're in a big city. So that's amazing. Wow. Any other specific tips for international travel?
Yeah, international travel. This is where I spend more time because now we're talking about managing fatigue, right? And fatigue is the biggest enemy to all of us in our moods, in our overall well being, in our mental state. And we know, particularly petite people living with dementia, fatigue quicker, and the impact is much more profound. And some, it's just sheer up, not wanted behavior. And so this is where I really say, if you can go business class, this is your time, right? And I have very frank discussions. Look, this is probably the last trip you're ever going to make. Let's be honest about this. Let's talk honestly and candidly. And we all have a last trip, right? So all of us at some point will have a last trip. So
Mhm.
if you have the resources, let's do it right. So if you can go business class, because now you have automatic access into the airline clubs. And I prefer the airline clubs. And sometimes you can buy a day pass. It just depends how busy the club is. I was through Charlotte not long ago. You couldn't get into any of the I just happened to be flying American Airlines since they're a major carrier here in Phoenix. I couldn't get into any of the lounges because they were packed. So this is where that can be helpful, is that, you make your reservation, you get in to the club so you're not out in the general concourse. Here, you can't necessarily fly at your best time of the day because there are no good times depending on where you leave. And international flights are almost always night flights. So that means, we're going to go from one location to wherever that hub will be, unless you're fortunate to live in, LA, San Francisco, New York, Philadelphia, right? Those are the places that you'll probably get a nonstop. But at any place else in the country, you're going to make a connection. Give yourself enough time. That's really important between flights. Don't ever, just because they say at London Heathrow you can have an hour and a half layover, you will never get from British Air Terminal 5 to Terminal 3 to get your flight to Dublin. So now you're going to be stuck, right? So a lot of counsel on that. And then how do we keep you occupied and how do we keep you comfortable during this long haul travel? Might the person benefit from some added medication at this point to induce sleep? We're not huge advocates of giving, but there are times that we're going to think about, do
Mm.
we need to add a little something just to ensure their comfort and yours? Because the last thing we want them doing is roaming the aisles. That could be really difficult. And then when you get there, do you have transportation set up so you can immediately go to your location, whether you're staying with family or you're going to be in a hotel, and you're going to now park it. You're going to get your meal, you're going to just do what you need to do, and then try to move into your normal in that setting. So a lot of counsel around the travel on the way there, and then obviously why they're there, how you're going to manage so you don't kill them with too many things happening. Medications the medication list has to be done in generic form, not in trade name, because if something happens, they don't recognize trade name as you're traveling internationally. And then if they're on any kind of psychotropics and you're going to the UAE or Japan, you need to kind of look at that prior because they have some different feelings about these medications. So you'd work with your provider in advance of that. And then the other is coming home. These are big jet lag trips. So this is where I say in general, you should not schedule anything for a week upon return, not even a doctor's appointment, really, unless something happened and you really need to be seen. Don't do it. Let's make sure that you have some groceries in the home, your mail gets delivered, do laundry when you can, don't worry about it, but you need to park it and expect that there'll be confusion for maybe even a week following a trip. And that often takes the family's breath away. They don't expect that. That's the one thing I don't think we've done well in communicating is, yeah, they're probably going to be confused for a couple days, if not longer. So it doesn't mean anything's wrong. It means they're trying to catch their breath again. Their brain is trying to catch up. This was a big whopping trip. But did you have a good time? And then, evaluating what worked, what didn't work. Give yourself credit that you did it as a caregiver because it's a lot of work.
Yeah. Well, it certainly sounds like that all pays off when you equip yourself with all of this kind of knowledge and education and tips that you provide, including in your book, Travel Well with Dementia, and you can keep reusing that for subsequent trips. It sounds like it's a mindset shift. It's a different way to travel, different and more preparation, but then you could have quite an amazing experience and then use that information again and again. I love it.
Yeah, I've had families say, "Hey, Jan, I can even use this information at home." And it's like, yeah, I know. That's
Yeah.
because we do travel, right? Even our outings are part of travel, and family comes to see us, and they need to understand what the gig is now. It's different, and yeah, this stuff it can really work if you apply
Hmm.
it.
And I love this GPS tracker shoe sole
Yeah.
technology. Like, this is amazing. I can't wait to look this up. Well, we're coming close to the end of time here. You've provided so much amazing information. Any um any last words of wisdom or final tips you want to give?
Yeah, I think it's just important to be realistic about what it is you want to do and what it is you want to accomplish as a person living with dementia and as family who will companion. And keep in mind the end goal. I still say it's about connecting to the people and the places we love. That is really what matters, right? There's something about going home. I just think about I'm from Michigan, and one of the things about going back to Michigan that I enjoy beyond seeing my best friend is a Kogel hot dog and Mooney's ice cream. It's seeing a favorite location that I once loved, right? So that's the beauty. So I rapidly forget. If I'm enjoying it now, that's pretty darn sweet, right? So it's kind of redefining what now travel looks like. And in some ways, I think it can even be more meaningful because it's much more intentional because we realize this is a gift and it's time limited for all of
Mm,
us. It's just the rest of us are living in an illusion that, we'll never get old,
yeah,
chronic illness, we'll always have our memories sort of thing, and none of that's a guarantee. So I guess my encouragement is just to get out and try and learn from it and accept help from people who are willing to give it because you meet some pretty nice people along the way.
beautiful. And that feels like that's the definition of being resilient, which is the name of this podcast. So how can listeners find you?
Well, I do have a website that I name my company Travels, play on traveling. So they can certainly go to my website, which is trav-alz.com. And there I do have some limited blogs and I have some planning tools that I think people certainly can help themselves to use. I have a variety of resources that could be very helpful for people to consider using as well when they travel. There's one other website, though, I also do want to plug. So, through my website, you can get in touch with me. I think on the screen you see my email address, jdougherty@travels.com. So, reach out to me through my email. I love that. But, I've been part of an international group for airports becoming dementia friendly. And so, there's a dementia friendly airports work group. So if you would Google that, if you will, you're going to come to a website that is rich with resources too, all around air travel, but about 80% of travel will become in the air. So listeners might want to take a look at that as there are some really wonderful resources listed there as well.
Amazing. And tell us about where to find your book.
Yeah, so my book here, I just happen to have it with me in case anybody wants to
Yeah.
see the cover, is Travel Well with Dementia's Essential Tips to Enjoy the Journey. And like everything else we get these days, it's available on Amazon and it's available in ebook as well. So it's good for the Kindle and it's also a good printed version.
Wow. Well, thank you. This has been amazing. I
Thank
always
you.
learn many new things every time I hear you talk about whatever you're talking about, and really appreciate your direct, honest approach, which is so infused with love and kindness and empathy, is of course as well as people, patients and families, and your team members and mentees like me have benefited so much over the years. So thank you for all that you've done and continue to do for this field. And so thank you, listeners. Please check out the show notes. We'll have all this information here about Jan, about how to reach her and travel well with dementia, and these different links for you and your loved ones. And finally, thank you as always for tuning in. If you're listening, rate and review us. And please like and subscribe if you want to learn more about Brain Love, my practice and business. It's mybrainlove.com, and feel free to email me anytime if you're looking for anything in this world related to Alzheimer's and resilient brain aging. Thanks again, and we'll catch you next time. Thanks, Jan.
Thank you.